Hi, everyone. I am Dr. Aravind Veerapandiyan. I'm a pediatric neuromuscular neurologist at Arkansas Children's Hospital. And I'm joined by Dr. Caitlin Batley today from UT Southwestern in Dallas to talk about some gene therapy updates. Hi, Caitlin. How are you?
Hey, I'm doing well. How are you doing?
Good. Let's talk about some of the data that was discussed in recent meetings like MDA and ASGCT on the microdystrophin gene therapy trials in Duchenne muscular dystrophy. I want to first talk about Delandistrogene moxeparvovec clinical trial updates that was discussed. There were a lot of data on that in the meetings, especially the long-term outcome data. I wonder if you have any thoughts on that. Anything was piqued your interest in that?
Yes, I think it was great to see this collection of kind of pooled data from several of the different trials to see that there was kind of long-term stabilization or slowing of disease progression seen in patients who were treated with Delandistrogene moxeparvovec compared with external natural history controls. We did see that the North Star ambulatory assessment total score had a slower decline than would be expected compared to these controls, with a decline from baseline of 2.55 compared to natural history, which was over 5 points. So that was a very reassuring finding for sure.
Sure. Yeah, I think they also showed similar improvements in some of the other functional assessments like time to stand and 10-meter walk run. And I also saw recently, I think from the ASGCT, they released the data on 8 and 9-year-olds, so the sort of late ambulatory were already in the declining phase that were treated as part of the Embark phase 3 trial at the part 2. So they've entered as one of the older ones in the study. They received placebo at part 1, and then part 2 they received the actual drug, and at the time they were 8 and 9-year-old, and they compared that to the propensity matched external controls and also showed improvements in the functional assessments. So I think reassuring to see those long-term functional data, but I think more to come from them.
For sure.
I think some of the other ones I'm trying to think. So Genathon, I think they are focusing on ex-US as of now on the clinical trials. I'm curious about your take on their data that was presented.
Yes, another really exciting program. I think always great when we're talking about the use of different kinds of viral vectors, hopefully to, provide different options for different patients who might have seropositivity for one, but maybe not the other. So this program uses an AAV8 viral vector. And some of the early data that we've seen has shown a sustained decline in creatinine kinase or CK levels, which, we are hopeful will translate to improved muscle stabilization. However, we know that this can be a tricky biomarker, that it can fluctuate a lot just on a day-to-day basis in the same person, and also is heavily impacted by the use of immunosuppressants and higher doses of steroids that we use for these clinical trials. So while the drop in CK is really exciting, we also do need to follow this with functional outcomes. And fortunately, we do have a bit of functional data, which shows overall very promising findings with the North Star Ambulatory Assessment, as well as the SV95C, or the Stride Velocity 95th percentile. And so both of those look to be trending in the right direction as well.
Oh yeah, I agree. I think we get excited to see this creatine kinase levels, but really it's how you take those results in the context. I would also be curious to see, they have 3 patients in this dose level 2, which is their target dose. To see individual level patient level data, I think that would help us understand if there's one patient that driving the whole improvement versus it's from all 3 of them. I think that would be interesting. And I think from their safety standpoint, do they have immune-mediated myositis?
Yes, I believe there was one reported case of immune-mediated myositis. And so their immunosuppression regimen, I believe, uses a combination of sirolimus and corticosteroids. So I think with treatment of larger, groups of patients in the next stages of their trials, hopefully we'll learn a little bit more about the safety profile of this particular therapy.
Sure, I think there was also in a patient with 8 and 9 deletion or deletion that included 8 and 9, if I remember correctly.
Yeah, I believe you're right. And then now moving forward, similar to other programs, that cohort is excluded.
Right. It's just exciting to have this different options using different vectors and, the construct, which are also slightly different from one to the other.